Happy Saturday. I am doing a video today on the cost of healthcare and its impact on retirees, that we should be part of this conversation. And instead, people are making decisions for us and the impact it's having. I want to bring you back to a couple of videos I did a while ago with a DC-37 retiree, actually two DC-37 retirees, Neil Frumpkin and Sally Robinson. And it's really important to put this in perspective, as because all of the meetings that we've had over the last couple of weeks, one thing that keeps resonating is that elected officials, politicians in the city council and the state don't really recognize who most of us are. And while you may have some retirees that make a higher pension, most of us don't. And that seems to be pretty hard for them to wrap their heads around. So what I want to do is show you a video. I want to show you a clip from that interview to hear her, where she talks about the costs that are being imposed on her because, of course, the MLC, Municipal Labor Committee, keeps passing more costs onto our healthcare plans. And by doing that, they were suppressing the rate, the benchmark of what the city had to pay up to. It bankrupted the stabilization fund. And they'll keep saying our healthcare is premium free, high quality, premium free healthcare. But what they were doing was, instead of making sure that the benchmark stayed preserved, they were charging you copays. They are charging you deductibles. And this is what they've been doing to pass costs onto you. You guys think that this is the health plan doing this. It's not. It is literally being negotiated by the Municipal Labor Committee's leadership. And every time they've done that, they've passed more costs onto you, and it's still allowing them to say, but your healthcare is premium free, but it really isn't premium free. And the way that they're managing the plan is by charging people who are using healthcare. So it penalizes your most sick and your most infirm. So I want to bring you back to when we spoke to Sally. You might remember this interview.
People are having to decide, are they going to go to all their medical appointments? Are they going to buy all their prescription medications? Do they have enough money to do this? Or do they have to pay their rent and pay their other necessities of life? And this is a shame. There is something wrong and there's something broken in a system where people can't afford the necessities of life. And that's part of our fight today, is to make sure that we live a retirement that is not from hand to mouth and choosing what necessities we'll be able to afford. That's just not right.
That's right, because I have to pay a lot for my prescription. I have prescription because, I have to take special medicine for cancer. I'm a diabetic and I have pressure. So medicine costs me. So I have to. And then I have a problem with my back, and I take special medicine for that. So it would cut down on a lot. So like a lot of people, you have to go and get a half prescription. So I hope that we can win this fight, that we don't have to do. We worked all these years and we want to live comfortable, but we can't live comfortable when we can't worry about, we got to do this and cut down, and can't afford to go to the store and buy what we want. Because if you want a steak, you say, well, I can't afford a steak, so I'm going to have to get something cheaper and eat potatoes and onions. That's what we have to do. So I hope that we can win this fight.
And after working 35 years for the city of New York, you shouldn't have to just eat potatoes and onions, my dear.
No, that's right. I can have some meat with that.
Good. So in this video, in reminiscing a little bit about that, she's a low-income retiree, and I'm going to remind you just how low income she is. And after working for the city for that many years, she ends up living with a granddaughter because she can't afford an apartment. And you're going to see exactly why that's the case, right? So let me bring you to the next video that I want to share with you, where I literally go into why she is in this financial situation. So Sally makes a pension of about $900 a month. Her Social Security is $802 a month. So if you look at the total, her total income is $1,702. You read that correctly. $1,702 a month. Sally lives with a relative. So you tell me if she would be able to afford any of the things that the union is saying that she should be able to pay up to. She never would be able to do that. And neither would many of us. So unfortunately, because the unions and the MLC, the city of New York, chose to eliminate all of our choices of plans, you don't really have a choice. So this video, again, shows you that Sally, and I think today those numbers are just about even to $2,000. This is about 2023, so it's 3 years ago. Remember, retirees only make between 1% and 3% income adjustment. They'll make a cost of living adjustment on top of the first $18,000 of her pension. And if she makes an $18,000 pension, which she does not, if she's making $1,000 a month times 12 is a $12,000 pension. And we got an increase this year of 1.2%, which she would get on that full $12,000. Whoops. $12,000 times 1.2%. That she only got 144 extra dollars this year. Divide that by 12, it's $12 a month. That's all she got. That isn't even a copay. And that's what Sally gets. So when these decisions are made or put upon us to say, this is what we're doing. We're going to finance our contracts by bringing in an additional 50-something million dollars or $60 million by charging retirees copays. That's a funding mechanism. It's a backdoor funding mechanism for a union contract. And that's exactly what the Municipal Labor Committee did. And we're still fighting that. And this is the financial crisis. You want to talk, this mayor and this administration is talking about making New York more affordable, ending the affordability crises. But what they're doing is the decisions that they are making, and remind you, this came from inside the mayor's office of labor relations under the de Blasio administration and carried into the Adams administration. The mayor's office of labor relations negotiated these deals with the Municipal Labor Committee that passed costs on to retired people. So now you see these two videos. It puts it into perspective as to who we are and what they're doing to us and the crisis they're putting on us. The same city that says it wants to stop, wants to make the city more affordable. You're literally killing us. And they don't get this because they don't see what our pensions are. Now, I want to go into another document. We received a couple of emails where retirees had asked us to provide more information on healthcare costs because they heard Speaker Menon making the media circuit this week and trying to talk about that she wasn't looking to make cuts, see what she can cut back expense-wise so that she didn't have to cut services, and that was her priority. So now I want to go into the New York City Office of the Actuary, and let me bring that to you so you could see what I'm going to be talking to you, where I'm going to be talking to you from. So you see what this report is, by the way. It came out last June. So this June, we'll get another one. This is on the City of New York and the healthcare program prepared by the City of the Actuary, okay? This was produced by the actuary, Merrick, and then it was sent to the comptroller. And I want to jump down to page, I think it's 20 or 26. Now, page 26, per capita claim cost, GHI CBP. Remember, this is last year because that plan is now gone. Plans are insured on a minimum premium arrangement while the HIP and many other HMOs are community rated. And it's actually, I believe, better to be community rated. It opens a larger pool rather than minimum premium is just basically, you're talking about they're just paying the claims from the City of New York. Costs reflect age-adjusted premiums for all plans, which means there's a whole, in this document, they actually break down the age population of the workers and the retirees, and we're going to show you some of that. Initial monthly premium rates as used in fiscal 25 and 24 valuations are shown below. Now check this out. Right here, let's look at this first column because this is last year. It's the most relevant, right? HIP HMO. That's the benchmark that the city has to pay up to, right? The city will pay the full cost of health coverage up to the HIP HMO. This is the benchmark that the city has to pay up to for every employee, retiree, and their dependent. So when you start seeing, and I know someone texted me yesterday that there was Vicky Palladino was on Fox News, and the Fox reporter had said something to the effect that we should be paying for our health care. So a lot of you were upset by that, and rightly so. She tried to say you should be paying for your health care. Someone sent her this video when you're done, when we're done, maybe tag her in it because it is going live stream to X. She should know what we make, what Sally makes, and then she's going to start to see right here what your health care costs are. So if this is the benchmark of what the city has to pay up to, non-Medicare single, let's just round it up, $1,000, $998.55, right? Non-Medicare family, $2,500. Medicare, this is your senior care plan. This is the 20% that Medicare doesn't cover because Medicare covers the first 80% of your bills, $200. We keep saying we are the least cost to the city of New York, and yet it keeps getting drowned out by all the disinformation from the people who've been trying to take your health care away. Mayor's Office of Labor Relations and the MLC. The GHI plan was the plan that was most favored. Most of the employees and retirees were in it. Non-Medicare singles, $1,000. So now remember what I said when we talked about the stabilization fund. The city only has to pay up to this amount right here. Right here. That's it. And the stabilization fund was supposed to pay the difference at any time if GHI was higher than HIP. If HIP is higher than GHI, money goes into the stabilization fund. But because of all the crap that they did by passing more cost onto you, suppressing the HIP rate, GHI became higher than the benchmark. Now, that difference between $998 and $1,072, you were supposed to pay because they killed the stabilization fund. The difference between that would have come out of the stabilization fund. This is why they were pressured to create a new plan, because they basically destroyed this one. Now, family, non-Medicare, $2,800. Do you see the difference between the family plan here? This is the benchmark, $2,446 versus $2,818. You'd be paying the difference every single month. Now, let's look at the Medicare rate. Our Medicare rate is $218.74. Senior care is under, I'm not quite sure why they're showing a higher number here. Oh, for senior care, this is the HIP plan. So this plan right here is the HMO rate, not the benchmark rate. This rate is the senior care rate. Remember, the court said that our rate, our senior care, was under the cap. Individual Medicare, individual. That's why you don't see single family. This is well under the 988. Now, other HMOs that talks about all the other plans that the city offers, but I want you to see crystal clear right here. This is the cost of the plans that from last year, 2025. Who cost more? Who cost more? Active workers, pre-Medicare retirees. A Medicare retiree is the least cost to the city of New York. Now, I want to keep going in this document, and I want to show you. Okay, here's your Medicare B premiums. This talks about the different Medicare B. You can see that the costs are not going up that high from 2020 to 2025, unlike the regular cost of healthcare, which is important to see. Here's another interesting thing. Medicare B premium reimbursement, which is also statutory. Only 90% of Medicare participants are assumed to claim reimbursement based on historical data that the city has. That means 10% of city retirees are not collecting their Medicare B reimbursement. For whatever reason that is, I do not know. Now, let's go down to page 28. per capita claims costs. The valuation relies on costs developed from 2023 state report, which were assumed to be suitable for this purpose. The fiscal year 24 were projected to trend with 25, and the age 65 costs are, I want you to see that number, non-Medicare, $23,000. Medicare costs, $4,132. I'm not done. Let's go down to page 37. Page 37. And I think did I want regular page 37? Nope. I don't know why I wanted that. 38. So what you can also see here is what the unions have negotiated with the city based on all the different pension systems. This one happens to be TRS. In what they get, 23, 24, 25, how many members, and because there's different titles, you'll see which welfare fund that this is, and how much money they are given to administer your welfare funds. Your union just doesn't reach into its pocket and say, hey, I'm just going to give you, prescription, vision, dental, hearing, whatever. They're actually getting, this is an annual amount of money per member that they're getting. So in this situation, whatever this welfare fund is, District 60, Unit 60, which is right here, DC 37 gets 1812 for, right? Some of these other numbers here, Professional Staff Congress gets 2029. So you could see some of the differences there. But this report also has how much each of the welfare funds gets. This is BRRS. So each of them here's police, and you can see all of them have different amounts of money, but they're all kind of about the same. Here's some fire. And I was actually kind of surprised to see a few other people here in getting welfare fund benefits, from UFT, PBA, whatever, in the fire welfare fund, which was interesting. Next, I want to go to, 37 was supposed to be head counts. And I'm either on the wrong page. Let's try jumping there. Okay, head counts. This is what I wanted. So this is how many people are in the plans. Here's pre-Medicare. So let's look at this first. And this will tell you how many people between the 5 different pension systems, plus these 2 down here, TIAA and LODW, are in the health plan. So GHI here, these are pre-Medicare in the pension system, HIP, HMO, others, right? So you can see in totality the number of people on the city health plan. Here's your Medicare numbers based on pension system, NYCERS, TRS, BRRS, police, fire. These are your 5 main systems, okay? And then HHC, NYCHA, and water, these are agencies that the city will forward healthcare costs to. And I'm going to explain why that's important a little later, because it goes to the misinformation that some people are putting out there. And it might just be misspeaking about this, but I want to also show you about that too. These agencies have to pay for their own health benefits. They are provided by the city, but the city gets reimbursed by these 3. So their costs are not included in that. And then the last page I want to go to is 56. And I want to talk to you about costs, because this was another question we received. So 56. So here's your costs in that are put out by the actuary, that you could see the different costs per plan. Let me go back a little bit. 56. Okay. Now, this top row is actives right here, is all active people. How many of them are in the fire, police, BRRS, TRS, NYCERS? The number of people the salary, average salaries that they're getting, the average age. So these are your workers. It appears the average age is somewhere in the 40s. NICERS is 47, TRS is 44, police is 37, fire is 40. You see all that? Okay. And then how many years of service, which is really crazy because if you look at their average years of service, which is right here, let's go there. This is whoops, that's salary. Come on. This shows you that there's not a lot of longevity in on these jobs anymore. You know, you've got 9 years in BERS. The highest here I'm seeing is 11, 12, 13, almost 14 years in fire. So it still shows a very young workforce. Now let's look at retirees, which is right here. And look at the age of retirees. Your average age in the pension system in NICERS is 71, almost 75 in TRS, 75 in BERS, 63 in police, 67 in fire. Your average age in total is 70 years old. So this is the population that we're talking about. Very important to understand that. Here again, it goes by benefit on how many are Medicare eligible, which is this line right here by pension system. Shows you 187,000 retirees from 2025. And this is the number we've been saying because the city keeps saying it's 250,000 Medicare eligible people. But this is literally an actuarial report. 62,000 spouses in that figure. That's probably where they're getting their 200 something people. And that will show you the average cost, your average age of the health plan. Now, there's one more document that I want to go into with you. And these we get by FOIL, and they're called Headcount reports. And let me pull up the last quarter for I want 2025. So let's see. Sometimes they don't go in order. Here we go. Okay. Now, these reports, let me come back to you and pull that in. So you can see this new screen. And this report also talks about, oops, where did that go? It's going to make me upload it. I know it is. Work with me. Nope, it still wants to give me the OPEB report. Downloads, nope, YouTube. Nope. All right, give me a second. I need to upload it. And this form that I'm going to share with you will be a document that'll show how many people are in the health plans, which plans that they're in, and so you could also see the cost of those plans as well. I like getting these documents because it's very telling about, you know, when you hear misinformation. So remember when I said to you that NYCHA and the water fund and HHC are not included in the cost of the city. So when we talk about what the city pays, there's two numbers that'll be given. The number of the cost of healthcare that the city has to pay for city workers. And then there's the number for all agencies it pays for, but that's not including that it's not going to reflect that they're actually getting reimbursed by those three agencies. So I do want to show you those, that report. If I could find where the heck it went, let me do it this way. Because I have way too many things on my computer. I'm getting closer. FOIA, okay. And head counts. And I want 2025, quarter 4. Okay. It's uploading. Pray it comes in. Okay, here we go. All right, let me see if I can make this. Can I make this any bigger? Nope. All right, you're just gonna have to trust me on this one. If you can't really see this document, will it let me make it bigger? Let's see, did that work? Nope, it didn't. Okay, so in this document, this is called a head count report. And it tells you that this was it's to Renee Campion, and it's from My Chow, who does their reporting on all of this information. And it's going to include the cost and head counts by carriers in the entire program, employees, retirees, whether you're Medicare, non-Medicare, and the plans that you're in. Okay, let me come to page 2 for you. So it shows you this chart. And on this chart, you'll see at the top, all people in all funds. You'll see all funds, and then in the second column is city funds. Now, if you see at the bottom in bold, all funds is $10.8 billion. City funds only is $9 billion. You heard me say last week that the cost of healthcare to the city is $9 billion. And when Speaker Menon said 11 billion, that wasn't entirely accurate, because that figure, all funds, includes agencies that reimburse the city for that. So the pure cost to the city is $9 billion. Not that that's anything, less left, to sneeze at, but it's still a big number, right? It does show you that 79% of the people were on the GHI plan at the time. It also shows you here that like 0.8% were on the Medicare Advantage plan. It also shows you in the HIP HMO, there's almost 17% of people on the HIP plan. So it shows you still the most popular plan in the city is the HMO plan. It also shows you that when the unions the MLC went to force retirees out of this plan, out of senior care, and push them into Aetna, that you also heard Mr. Garrido say, everybody chooses Aetna all the time. Well, I'm showing you right here, there's 11,000 people on that plan, and most of them are dual contracts, and it's a 0.8%. It's not even 1. And again, this is from 2025. So recognize the numbers. They were trying to force you into managed care. This new NYC EPPO plan is becoming managed care. I have to keep saying this because I'm not being heard, apparently. I want to go to page 3. So let me come back to you and change my page. And here's page 3. Health insurance, total employee by health insurance carrier. Again, all funds, which is all agencies, just city funds is the second column. It shows you how many people are in those plans, how many contracts they have, right? So a contract could be a dual, like a split contract where one person's on Medicare, one's not. Here's your total retiree by health insurance, and this is in millions. So here's your total cost. You've got the highest cost is going to GHI. 89.2% again of retirees are on the GHI CBP or were on senior care. And in this retirees, 1.2% shows you 8,000 people are on the Aetna plan versus the employees. You got 2,000 employees on the Aetna plan. That means that they're paying premium. The retirees paying being on Aetna is 8,000 people. That's not a lot. Again, you're looking at retiree cost is 2.4 billion versus active workers at 6.6. Next, I want to come down here to non-Medicare. It's going to break it down for you even more. For city funds, non-Medicare, 8.4 billion. Breaks it down a little bit. Then here's your retiree Medicare, 577 million. 577 million Medicare retirees are the least cost to the city of New York. I can't keep proving this enough. I'm going to actually take a screenshot of that and remind people exactly what they're looking at, because this just shocks me that I have to keep saying this all the time. Medicare plans and senior care, it shows you who's on managed care, who's on the HMO versus who's on senior care. Hold on, let me go back to that. I'm going to show you, so I need to change your page. This is table 4 and table 5. This will show you your total. This is what I was just talking about because I forgot to change your page. Your total non-Medicare, here you are at $8.4 billion versus $577 million for a Medicare retiree. This shows you the difference. Then here, where I was telling you, there's the Medicare plans versus senior care, how many people are, depending on what their geography is, on where they are in managed care. The budgetary impact of a 1% increase will tell you what that is right here for 25, 26 with a 1%. Employee headcount by groups, it tells you where the most employees are. And that's the report. I want you guys to understand, a Medicare retiree is not bankrupting the city. The cost is everyone who's pre-Medicare. End of story. That's all I can tell you. So Maggie, you can send this to Vicky Palladino. She actually stood up for retirees when the reporter from Fox News misspoke and said retirees should pay. Vicky didn't get into the details, but she did defend you on that. So you can say thank you to her. And I actually just met with her again the other day. She did say to the lady, they've been fighting for years in court, because the reporter was like, well, they've been in court forever, almost like that was a bad thing, but she didn't understand. So it would be more effective, rather than for you to go to Vicky, who does support retiree healthcare issue. You might want to reach out to Dagan McDowell and Fox News and educate her and share her this video. The legend of Liberty Valance. I keep saying that. Absolutely, Ellen. If you repeat a lie often enough, it becomes the truth. And this is what they keep doing, because they want you. Oh, they're old. Oh, they're sick. Oh, they're disabled. They cost too much. No, it's not retirees. And we said this again when we did the video last night. Most of our healthcare is paid for by Medicare. Very little of it is paid for by the city of New York, and that's because between Medicare and us now paying, because the mayor and the MLC negotiated that you pay, insurance doesn't really pay much for you. So they're misrepresenting a whole lot. Gregory, I had a DCAS title and I'm a NICERS member who worked for MTA. I'm trying to find out about this apparent disconnect. So really, Gregory, it's really who you get your healthcare from. A lot of MTA people, they'll get their pensions from the city and they'll get their healthcare from the state. But NICERS, and that, I don't know if you're getting who work for the MTA. You might be a DC 37 retiree who still gets both from the city because your title is under DC 37. I do not know that answer, but only you would be able to tell me if both your healthcare and your pension come from the city of New York. Your pension, yes, I would understand that, because even the MTA New York City transit workers, their pensions come from NICERS, but their healthcare comes from the state. So I don't know where yours is coming from. Only you could answer that question for me. People are getting dumber in positions of power in New York City. Yeah, I'm really sorry about that. Gregory is worried about Part B reimbursement. Oh, so Gregory, if you are a state retiree, that bill comes up all the time. That doesn't mean you stay complacent to it. The governor is always looking to cut costs, and that bill comes back every single year. I'm not quite sure what the story is behind that, but what you have to do is just contact the governor and keep telling her advocate with RPEA, which we've joined efforts with a couple years ago, in advocating to protect for retirees. They cannot diminish benefits to you in retirement and not expect you to fall into a financial crisis. You've worked all of these years for exactly that benefit and that peace of mind. Marion is providing data only city retirees. The data does not include state retirees, and non-mayoral agencies refer to the state, but state agencies like EDC, HH Culture. Yes. So, but in that realm, if they get their health care from the city, like I said to you, HHC, housing, and the water authority, the city would provide those benefits, but those agencies have to reimburse the city for them. So when you heard, like when last week you heard Julie Menon say that healthcare costs, I think she was on New York One, healthcare costs are $11 billion. It's not really 11, it's 9, because she included the other agencies that reimburse the city for those costs. It's a misspeak. It's not a critical error, but to understand the differences in the numbers, that's really important. We knew it. Our advisors knew it, and they were like, "Did you hear what she just said?" I was like, "Yep, I heard." And do you pick a bone over that? I mean, I could have called her and corrected her, but I know what they're doing. They're trying to make things seem as critical as they are, or they think that they are, and that they need more help and more money and more whatever. I mean, look, the mayor came out and said that the budget is $12 billion deficit. I mean, everyone we spoke to in finance said it's not really $12 billion. So I think they want to make a problem so that they look really good when they fix it, but it's not entirely correct. So that's why I keep saying to you, I know he said like this, he's not doing what every other mayor does. Well, he actually did. He just did it with more charisma. But don't freak out, because this is a show. And I have to keep saying this. I know a lot of you got worried about it, and it's just not real. The reason I think only 90% of Medicare retirees claim Medicare Part B reimbursement is that, unlike OLR, non-mayoral agencies do not make it easy in terms of paperwork to claim it, just my opinion. So, Gregory, all they have to do is fill out a form on Labor Relations website. That's as simple as it is, and send it into OLR. So I don't know why it's not easy. You can even upload it into the portal. You could send it to them certified. You could mail it. You could email it. I mean, there's many ways for you to do that. Using their own retirees as products to be bargained with instead of people. Yeah, so I think more or less that also started around Bloomberg when he renamed the office of Human Capital. I just find that name so horrible. It's not human capital. You are not human capital. It's icky to me. It just really is very icky to me. And I don't know why no one has fixed that yet, to be quite honest with you. Stop being nice, call out their lies. Well, what could I tell you? Yes, low-hanging fruit, easy pickings, and that's exactly what it is. My pension and healthcare both come from New York City. I'm under DC 37, not TW. Yeah, so that's why I don't understand why it's difficult. OLR has the Medicare B reimbursement form. Fill it out. If your joint family income is over $90,000, you will probably have to pay an IRMA, income-related Medicare adjustment. And that form is on OLR's website too. Remember, it only comes out just before you're eligible to fill it out for the year prior, like it should be coming out soon. And if you haven't filed for it, it only goes back 3 years. So if you haven't filed it in 10, you're only getting 3 years back. They're not letting you go all the way back. So if forever anyone who didn't do that, I know they don't want to hear me say that, but fill out the form and send it in. Bloomberg is icky. Yes, I'm serious. Get tougher. I hear you, Vince. So I hope you found that informative, and I hope it was helpful in the grand scheme of things. We're already 40 minutes on this, and I know people really probably aren't going to watch the whole thing, but I'll try to make some short clips like I did this morning and put those up from yesterday. I hope you found doing the video with Matthew and Ellen interesting and educational, and share those with your unions. Also, in our Facebook page, I posted the CWA 1180 Welfare Fund SPD for retirees. You should find out your SPD from your union's welfare fund. And if the union welfare fund has the SPD published, great, look through it, and you want to know what the privacy rules are. If they don't, call and ask them for one. Where's your SPD? Can you please mail it to me? What is your privacy rules? How have they been updated? When was the last time they were updated? Even MBF, Ellen, I sent you a copy of that because I think that's something too that theirs at least explains why they're doing what they're doing. So this is why I think it's important for you guys to look at that, because you might have something to say in the grand scheme of things of the city share, unions sharing your welfare fund data. Maybe they change their mind, maybe they don't. But you know that when you use your voice, you have the power of collective action in making that union understand you're not going to tolerate this. So you may want to start calling and emailing your union's welfare fund and letting them know how you feel about the NYC EPPO data if you're the under 65 crowd or pre-Medicare crowd or the active worker crowd that's listening to these videos, to understand that your welfare fund data, drug data is being shared, is going to be shared if your union agrees to, with United Healthcare UMRN emblem. Also, if you are MBF, managerial benefit fund, you're on the city drug rider, meaning you're paying for it, you should know what the privacy rules are there as well. You should also call OLR and ask for those, or email them and ask for it. That needs to happen. I did not go up on the OLR website and see if they actually have that on there. You might want to do that. And then let them know how you feel about that, and ask them if you can be exempt from that. You do not want your data given to UMR UHC. And then if for those Medicare people who are on the city drug plan and in MBF, I honestly don't know if your data is being shared. You might want to ask them that too. And if you're in a union drug plan, you're in a union welfare fund plan, you might want to ask that welfare fund, I'm on Medicare, are you sharing my information too? Because it's worth asking. So, yes, get ready for the blizzard, everybody. Make sure you have everything that you need, and enjoy your weekend. Stay warm, stay cozy. Make sure you have your bread, eggs, and milk. And I'll probably see you Monday on the radio. Have a great weekend, everybody. Ciao.
Don't speak what you don't understand. The truth is not in your command. Don't shout about what you think is fake. The decision isn't yours to make. Don't lie about the way things are. The tall tales will take you very far. Don't scoff when they say it's the end. In this life, you know you can't pretend. The days pass by, baby, set in stone. But it's not too late now for you to change your tone.